The first thing you need to understand is there is what's called in-network billing. That means that the doctor carries a contract with the insurance company, meaning I agree that when I bill you and you tell me what you're going to pay, I accept it and I do not go after the patient for the additional amount. The other set is called out-of-network billing, which is I will bill you and then I will decide if the patient has to pay a portion or I will write off that amount. Years ago, a lot of providers were going out of network. They were tired of these in-network contracts. They were tired of having to eat large amounts of money, not being allowed to bill the patient other than what the insurance company says they were supposed to, and they went out of network. And a lot of them were able to be a little bit more successful because as long as they were ethical about it, they wouldn't stick patients with thousands of dollars, but they were able to go ahead and collect on those claims and get paid a little bit better. Insurance companies have gotten savvy to that. They now will, for example, not have what's called out-of-network benefits for a patient, or they will have out-of-network benefits that are so astronomically high, there's no way the patient could see someone out of network. There is a healthcare system or healthcare plan, let's put it that way, that is run by a county hospital. Went to a larger health plan and said, we would like to have our own healthcare plan in our local county. And anyone who is part of this bigger plan, we want them to now be in ours. So what happened is all of these people in this certain area that had this insurance were now part of this plan. And their deductible went from $4,000 if it was out of network, meaning if you saw a doctor that wasn't contracted, you'd have to pay about $4,000 before the insurance would pay. It went from $4,000 to $50,000 a year for one person.
And that's one of the problems. I mean, that is not ethical right there. And
No,
that is a county hospital. I'm just assuming, is it a public hospital? Is it a public? If it's a county hospital, it's probably public, right?
it is public, yes.
Supported by tax dollars. And this
Yes.
county hospital went into a county and said, we want to set up our own group and we're going to basically create a monopoly. And if you don't like it as a patient, too bad, because if you want to go out of network, it's going to cost you $50,000 as
Yes.
a deductible instead of $4,000. And the insurance company let that happen. So there again, the hospital is in bed with the insurance company, creating a monopoly. What does that do? Service goes down, price goes up, period.